We live in an age of medical miracles. Today, we can sequence a genome in hours, print human tissues, and perform surgery from across the globe. Treatments that seemed like science fiction just decades ago are now part of our reality. Healthcare professionals achieve what previous generations would have called miracles every single day. Yet behind these incredible advances lies a painful paradox. As doctors, nurses, and clinicians break new ground, they face unprecedented burnout. As patients rely on them more, we risk losing them. By 2030, the world will face a shortage of 10 million healthcare professionals. At every stage of care, from primary visits to emergency response, practitioners grapple with mounting administrative burdens and decision fatigue. And the data, it paints a sobering picture for us. 68% of clinicians work unpaid overtime every month. 58% of healthcare professionals experience burnout, with 41% experiencing it monthly. 28% are prevented from delivering the highest standard of care due to burnout, and every week, 25% of healthcare professionals consider leaving the field altogether. AI is helping. In some cases, it's reducing documentation time by up to 80%. But many AI projects are stuck. While some general-purpose AI appears to be outperforming human doctors in the lab, in the clinic, it's a different story. Healthcare systems and their IT departments are often concluding that this same AI that beats doctors in the lab is too expensive, it's not built for their workflow, nor is it safe enough. So why is it that we're failing to go from concept to clinic? Because there's a fundamental mismatch. Healthcare is a field of specialists, and we're applying general-purpose tools to its highly complex needs. While ChatGPT has accelerated global AI adoption, healthcare cannot rely on AI systems trained on everything from society columns to social media. Think about it. Would you use a Swiss Army knife for surgery? Of course not. Healthcare requires specialized tools for specialized needs. General-purpose AI does not work in healthcare. Already, we're seeing early signs of new problems emerging. A third of the healthcare professionals using AI in the US today are spending up to 3 hours a week correcting it. Picture this: an ER physician in LA, overwhelmed with 4 hours of daily documentation, adopts AI for relief. At first, it helps, but then hallucinations creep in. Now, she's fact-checking AI outputs and juggling systems instead of focusing on patients. Her trust in AI and its utility begins to erode. Hallucinations can be frustrating in casual settings, but in healthcare, they can be catastrophic. That's why healthcare deserves better. Healthcare needs specialized AI because we wouldn't trust our health to a generalist. Healthcare needs an AI that truly understands that a positive test doesn't always mean that the test is truly positive, and the discharge is not something to dodge. Today marks a pivotal opportunity in healthcare AI. We're excited to finally unveil Corti's foundation models to all of healthcare. This is an industry first. AI infrastructure built from the ground up for healthcare professionals to support healthcare workflows and healthcare only. Our AI tackles the intricate demands of healthcare that only a specialized models can prioritize. Firstly, healthcare demands AI built for purpose. That's why we've spent 4 years training our models on hundreds of millions of hours of domain-specific data. By focusing solely on healthcare, we're eliminating the noise, leaving only insights that matter. Secondly, healthcare language is its universe of its own. We've built deeply nuanced understanding of medical terminology tailored to over 50 specialties and 10 languages. So our AI speaks the language of care fluently. Thirdly, in healthcare, mistakes aren't an option, and patient data has to remain sacred. Our infrastructure is highly accurate, compliant, and built to meet the highest global and local standards for both patient and data safety. Finally, healthcare means every moment matters. Our AI is lightning fast, built to reason in real time, augmenting healthcare professionals to power care without compromise. Let me introduce you to our three models, the new foundation for healthcare AI. First, meet Solo. The model lets you build expert note-taking AI, giving you back hours of documentation time each day. It handles medical terminology across 50 specialties in more than 10 languages with unprecedented accuracy. Next, meet Ensemble. Ensemble lets you build AI agents that turn words into actions. It transforms live discussions into structured medical documentation that is significantly more accurate than general-purpose AI. Now for Symphony, the world's first streamable AI model for healthcare. Symphony is 35 times faster than general-purpose models, which means it's fast enough to help healthcare professionals in real time while in the moment with the patient. These models will remove dozens of administrative burdens faced by millions of healthcare professionals worldwide. If a rural clinic in France needs an extra pair of hands to take notes, that's Solo. If a doctor needs more time with the patient instead of paperwork, try Ensemble for ambient documentation. If a nurse needs to check clinical guidelines before making a decision, step it up with Symphony. Our foundation models are built on 9 years of peer-reviewed research, and we know we're not just building technology. We're trying to build trust back into technology. This isn't about replacing healthcare professionals, nor is it about rushing into quick fix solutions. It's about creating an AI infrastructure for healthcare that elevates and augments practitioners in their critical work. With burnout rates soaring and administrative burdens consuming precious hours, we're building trusted technology that returns healthcare professionals their most valuable resource, time with patients. Because those who have dedicated their lives to saving others deserve AI as dedicated to supporting them. Now here's my co-founder, our Chief Technology Officer, Lars Malø. Thank you.
Thank you, Andreas. You know what keeps me up at night? It's not the technology we're building, it's the responsibility that comes with it. 9 years ago, when Andreas and I founded Corti, the promise of healthcare AI shone bright. But today, as CTO, I see a landscape that deeply concerns me. We could be in the midst of a golden age. Instead, an AI gold rush is flooding the market with well-intended solutions that are failing our healthcare professionals. In ambient scribing alone, there are now over 60 apps to choose from. The promise of AI is to solve some of healthcare's biggest problems, but many apps are inviting new complexities instead. Every part of the healthcare professional's workflow is about to become AI-enabled. If that means lots of new apps, it will simply not work. The difference in complexity between an out-of-the-box, fast-to-build AI and an AI that has been carefully built to solve an expert task is significant. Similar to the difference between a specialty doctor and an intro-level med student, good enough will never be good enough in healthcare. The stakes are simply too high. 75% of healthcare professionals support AI use in practice, but over half say they wouldn't feel confident using the current solutions. Healthcare systems are stuck in what we call pilot paralysis. AI projects are failing to launch, unable to scale beyond trials due to challenges with accuracy, cost, and integrations. The problem? General-purpose models have been quickly implemented to form the backbone of healthcare's AI infrastructure. I believe any school teacher that has seen GPT-4 plagiarize essays will agree to the fact that such essays will be brilliant at reaching the uninspiring level of mediocre. AI offered for specialized tasks today is ironically very unspecialized. General-purpose models are impressive and versatile, but like jack of all trades who know a little bit about everything, they are the masters of nothing. In healthcare, this creates tools that miss critical nuances and make unreliable notes. Tools that are dangerously verbose and fail to integrate into legacy systems. Never designed for the complexities of healthcare, general models have overpromised and underdelivered. Providers are left spending months piloting solutions that don't quite fit. Instead of taking flight, healthcare AI is grounded, unable to move from concept to clinic. This isn't progress. This is AI pilot paralysis. Our foundation models are trained on something we call AI in residency, inspired by the concept of medical residency. Just as medical residents progress through structured levels of responsibility, our models are designed to grow in complexity and reliability, proving themselves capable before handling more high-stakes tasks. They are deeply trained and honed exclusively for the complexities of healthcare, learning from the context of real-life patient interactions, peer-reviewed papers, and medical data. Unlike AI built to beat human doctors on specific exam papers, they have not been developed to lead an index. Instead, they're trained for the tough realities of healthcare, to actually help where healthcare needs it most, to firefight administrative burden and burnout risk plaguing healthcare. Corti's foundation models are built and trained so that every output is tested and validated in the healthcare domain. They're traceable, auditable, and compliant with relevant healthcare regulations. The results speak for themselves. We are 25% more concise than GPT-4, supporting time-poor clinicians with sharper precision. 20% more accurate than GPT-4 in healthcare contexts, as accuracy here is ethics. 35 times faster than GPT-4 because in healthcare, seconds can mean lives. Earlier, Andreas unveiled the first healthcare AI infrastructure of its kind, comprising 3 new models exclusively available to healthcare systems. Solo, a fast model with audio reasoning, creating expert agents handling complex medical terminology in over 10 languages while integrating effortlessly with existing systems. Ensemble, a powerful model focused on exceptional documentation, creating expert agents that turn consultations into action, transforming medical discussions into structured documentation that is 25% more concise and more accurate than general-purpose AI. Symphony merges powerful reasoning with speed. It is a streaming model operating 35 times faster than GPT-4 and provides evidence-based insights during patient consultations, showing true agentic behavior. Here is where it gets exciting. Picture a medical center of excellence, but in AI form. On top of our foundation models, we've built 20 expert models, specialized capabilities that augments each foundation model. Think of them as medical specialists, coding experts, quality control experts, summarization experts, each one purpose-built for healthcare, compliant by design and ready to integrate into existing workflows. I'm now joined by Dr. Lasse Krogsbøl, who is a general surgeon and has worked clinically for 14 years. Luckily for us, he now works on the product team at Corti. Lasse, you've been out there in the real world. Give us some examples.
Yeah, we've been implementing this in a wide variety of settings and use cases. And one example I'll give is from a leading private healthcare provider in several countries that have been using our models for summarization of the clinical visit. And they were able to drastically reduce admin times doing this. And we also achieved a 100% user satisfaction rating. And in my career, I've used a ton of healthcare software, and to be honest, I really didn't like much of it. So I'm really happy that we're able to give users something they actually like. Another use case is outpatient clinics in Sweden that used our model for coding. And coding is a task that is tedious and it's time-consuming, but at the same time, it's really important for billing purposes. And that's a terrible combination if you are a busy clinician trying to treat a lot of patients. So in this case, we were able to increase the quality of the coding and cut in half the time the users spend on creating the codes. A third example is emergency call center services, where a customer in the United States used our model to help the call taker discriminate, is this a true emergency that requires a proper emergency response, or is this not really an emergency and can be safely handled by an online nursing advice service? And we were able to optimize this emergency workflow by freeing up resources, by providing more than a 50% increase in the number of calls we could safely route to the nurses. And if we can do emergency calls, then we can do a lot of things because the stakes are very high in that setting.
Makes a lot of sense. Thank you so much, Lasse. What's remarkable isn't just the performance, it's the flexibility. We're using the same infrastructure across all these use cases, just configured differently for each need. Think about electricity. We don't expect hospitals to generate their own power. They plug into a reliable grid. Similarly, we don't expect every healthcare vendor to build their own AI infrastructure. They should be able to plug into a trusted healthcare-specific AI grid. At Corti, we've built that grid. Our infrastructure is built for healthcare from the ground up, compliant with regulations, ensuring safety and trust. Flexible, supporting multiple specialties, languages, and use cases. Scalable, working across hospitals, clinics, emergency services, and more. Cost-effective, making cutting-edge AI accessible to all. Easy. Easy to trust, easy to integrate, easy to buy, and easy to understand. Let's create a connected, interoperable ecosystem that breaks out of pilot paralysis thanks to a specialized, high-quality infrastructure. One that's elegant in its simplicity, effective in its execution, and most importantly, one that works seamlessly in the everyday moments where it matters the most. The stakes are simply too high to continue with solutions that don't quite fit. It's time for AI to graduate from endless pilots to everyday practice, to move from promise to performance. Together, we can make AI what it should have been all along. An indispensable, invisible ally flowing through healthcare systems. Electric, elegant, accessible to every clinician in every clinic, everywhere. Thank you.